milk in your bosom and tears in your eyes. O frail woman, that's your life. A quote by Subhadra Kumari Chauhan.
Starting, I felt the pain in the stomach. Immediately, I was the pain was very severe.
I found a lump in my left breast 2.5 months back.
There seems to be no life for women other than pain and suffering. Beginning with puberty, followed by marriage, pregnancy, childbirth, and menopause, a woman undergoes several traumatic experiences. All of them are painful, either physically or emotionally, or both. What exactly is pain? Pain is probably the most fundamental and primitive of all sensations. It is protective in nature. It is essentially a warning signal that something is wrong somewhere. Pain involves pain receptors and pain pathways. Nerve endings for pain come together to the spinal cord through the ascending tracts, reach the thalamus, which is the primary center for pain in the brain.
Since 3 years, I am suffering from knee joint pain. There is arthritis, and this pain alternates to sometimes right and sometimes left. Since 3 years, this pain increased severely.
Though men and women both experience pain in one way or other, Indian women tend to suffer in silence. Most of the time, their suffering goes unnoticed and unattended. During her entire lifetime, a woman suffers due to a variety of pains. Urban and rural women doing heavy manual work suffer physical pain.
This
patient, Venem Manama, came from a rural area in Mahbubnagar district. They have to work in the fields for earning their livelihood. She sustained injury to the cervical spine, that is neck region, while carrying a weight on her head, and she had atlantoaxial joint dislocation.
The women who are usually coming, they are coming with gynec problem. But as we all know, when they come to a lady doctor, they come with not only just with the gynec problem, they come with all the symptoms which may be related to her, starting from headache, from neck pain, and most commonly the most common pain what we find it in our day-to-day encounter is the backache.
Emotional pain in women is usually associated with chronic diseases. Emotional stress can also increase the intensity of pain.
Students are also expected to work most of the time so that later on it's easier for them to get jobs. That also adds on to our everyday stress levels and pain. I mean, it's not really easy to handle college life and workplace that effectively and that easily. So I think that also is a pain factor in most of our lives nowadays.
We are like walking on the road and all, and you see those filthy look on the people's eyes as they are almost undressing you every day, and the way they treat you as if it's so much painful, because no matter how much we progress, get IT, get biotech, get whatever, but this thing stays the same. So no matter what, this is very painful.
Every time exams come up, I'm the person who starts studying maybe 4 or 3 days before the exam. So it gives me a lot of emotional pain because I do want to do well.
Chronic pain emanates from certain diseases like arthritis, traumatic injuries, cancer, and some chronic illnesses.
The most unfortunate thing about the cancer pain is that this pain, compared to other pains that we undergo, it is an intolerable pain and it sustains for a long time. For example, if a woman has breast cancer, we usually operate for these patients, and they lose an important organ in the body, especially. And then these patients do feel a complex they develop in the life. And when organ is lost, which is very especially the young women, and they do have some sort of a psychological pain or emotional pain they do develop.
Indian women, this cancer of cervix is very common, and even cancers in the breast are also common. So these patients are treated according to their stages. In early stages, we do simple surgeries, and in late stages, we give radiotherapy, and in still later stages, we give chemotherapy.
Pregnancy and childbirth is perhaps the most eventful and fulfilling phase in a woman's life. A woman experiences acute pain during labor.
The Indian women tolerate labor pain better. Most of the deliveries are done in the villages, where the older generation, they expect them to have pain and deliver the baby.
This is a lady who had come to me with 7.5 months pregnancy, and she was complaining of pain which was coming spontaneously. It was coming in short intervals of small durations, and it was going on increasing. When we evaluated her, we found her that she was going in for preterm labor.
The perception of pain seems to be different in women belonging to different strata of society. For instance, the more the educated a woman is, the less is her pain tolerance or pain threshold. She promptly seeks medical relief. On the other hand, rural women have higher levels of pain acceptance because of their strong mental and physical makeup. Hence, they neglect themselves and their pain. An urban woman speaks of her awareness level.
10 years from now, things have drastically changed in terms of pain. We have been rather trained into tolerating a lot of pain, but over the period I think we are becoming more verbal in expressing when we are in pain.
I don't suppress, but if there are minor pains, I don't pay any attention, I try to ignore. But when they become sort of, I can make out whether it is necessary to attend to, consult a doctor, I do go and take their advice.
Lot of difference between the perception of pain between the rural and the urban women. If you ask me why, the rural women are possibly brought up with the pain, and they face enormous problems and pain in their lifetime itself, and their capacity to face pain is more. Their tolerance level is very high, and also they are physically more strong than the urban women.
Women belonging to lower strata in rural areas depend on home remedies and quacks. They go to a doctor when the ailment is too serious, either due to shyness or lack of resources. A rural woman explains her difficulties and whether she buys medicines promptly.
जल्दी तो नहीं बोलते, अभी थोड़ी देर वेट करके बाद में हॉस्पिटल जाते। पैसे भी रहना चाहिए ना अपने पास, उसके लिए वेट करते।
Rural women suppress pain because they are shy of doctors and try to avoid an internal examination. In case of ovarian malignancies, they go to a doctor during the 3rd stage. By then, it is too late.
They would have tried all the other measures like painkillers, applying balms, going to quacks and all that, and then they will come to us.
A woman suffers more pain because she is directly exposed to the pain of her family members.
ఇంట్లో చేసేది ఆయనే కదా మరి ఆయన మొలబడ్డప్పుడు మనం చేసేది ఎక్కువ బాధ అనిపిస్తుంది.
Suppose somebody in the family has cancer, the husband, the daughter, the son or a mother or somebody else, and again their cancers also lead a lot of emotional trauma and turbulence in the woman's mind, and they do undergo a great emotional pain because of somebody's cancer in the family.
She suffers her own pain without a complaint. Are women biologically superior to men when it comes to handling pain?
In women, naturally they already had seen some incidences of severe pain conditions, situations like labor pains during delivery. Maybe their mechanism in the body itself is prepared already for future painful situations. Thereby they will be able to tolerate better than men in general.
According to the Second International Conference on Women's Health, a woman is less likely to receive treatment for pain than a man.
When it comes to a general practice in general medicine, a woman who is complaining repeatedly of pain and aches is, especially after some time, the physician is less likely to react to the pain.
I don't usually promptly express a pain. I wait for quite some time for it to subside by itself. If it doesn't subside, if it's really very bad that I need to tell someone, then I go ahead with it. Otherwise, I don't. I try to manage the pain.
I'm an arthritic patient for a very long time, so I suffer from pain very often. And then now I'm so much used to it, I don't give that much of importance to that. I try to ignore it as much as possible, but if it becomes serious, I take the painkiller. And then one more very important thing is to reduce the pain and then be more fit, you have to do a lot of exercise.
Are Indian women more tolerant to pain than their Western counterparts?
Tolerance levels for pain in Indian women is definitely higher. And we also have the support group to take on that pain in terms of our immediate family or the outside family as such. In terms of the Westerners, I think they're more aware and they voice it faster. That's the advantage that they have.
Pain can often be misleading. Each organ in the body has its own pain nerve representation on a certain site of the skin called dermatome. Pain from the organ is referred to its particular dermatome, and this is called referred pain.
Referred pain is a pain arises from the internal organ and refers to a different area which is supplied by a common nerve. The examples I could give: the pain arising from the left side of the chest, which is from the heart, may radiate to the shoulder, may radiate to the patient's left side of the jaw or to the mid-back. Another thing is the pain arising from the uterus may radiate to the middle of the back, including the pancreatic pain where it arises the epigastrium, which radiates to the back. Another pain is from the diaphragm, which also radiates to the patient's left shoulder.
Most women show fear of pain, including the fear that it will worsen. This itself will make her perceive it as more severe. She can tackle her pain better if she is aware of the options available for treatment. Pain balms like creams and ointments provide relief from mild to severe pains. Transcutaneous electrical nerve stimulation, or TENS, is a non-invasive technique where low-grade, non-painful electrical bursts are administered to strategically located areas on the skin in case of severe pain. Exercises help to block pain signals through distraction and the release of endorphins. These are endogenously secreted morphine-like substances that help a woman to cope with chronic pain. They act like natural painkillers. Women are biologically superior to handle stress and pain when compared to men. they recognize pain much better, are more sensitive, and are more in touch with their feelings than men. Unless men take pains to understand a woman's pain better, women will remain a mentally battered lot. Only the degree may vary from woman to woman, irrespective of which class she comes from. Will the situation ever change?